Musculoskeletal care is undergoing a major transformation. This presentation explores how physiotherapy is shifting from generalized treatment approaches to precision-based, evidence-driven, and technology-assisted care. Traditionally, musculoskeletal conditions were treated using one-size-fits-all approaches and largely subjective assessments. The new paradigm focuses on precise patient classification, objective measurements using technology, and integrated evidence-based protocols. The new paradigm in musculoskeletal care is built on 4 pillars. First, accurate diagnosis. Second, meaningful classification of patients. Third, strong evidence guiding intervention. And fourth, an integrated clinical model that translates research into everyday practice. Accurate diagnosis is the foundation of effective musculoskeletal care. Traditionally, assessment of spinal and musculoskeletal structures relies heavily on manual measurements taken from imaging such as MRI or radiographs. However, these measurements are highly dependent on clinician experience and interpretation. This leads to inter-observer and intra-observer variability, meaning the same image can produce different measurements when assessed by different clinicians or even by the same clinician at different times. Manual measurement is also time-consuming and limits the ability to analyze large volumes of imaging data efficiently. As a result, subtle structural changes may be missed, affecting clinical decision-making and treatment precision. Artificial intelligence has revolutionized musculoskeletal diagnostics. AI-based systems can automatically segment and measure spinal structures with high accuracy, providing objective and reproducible data while reducing clinician workload. Treating pain as a single nonspecific condition oversimplifies patient problems. Research shows that patients with similar pain presentations often belong to different subgroups, each requiring specific and targeted interventions. One of the most important advances in modern musculoskeletal care is the classification of neck pain. Rather than treating all neck pain as a single condition, evidence-based guidelines recommend classifying patients into specific subgroups. These include neck pain with mobility deficits, neck pain with movement coordination impairments, cervicogenic headache, and neck pain with radiating or radicular symptoms. Each of these subgroups has a different underlying mechanism and therefore requires a different treatment approach. For example, mobility deficits respond well to manual therapy and mobility exercises, while movement coordination impairments require motor control and stabilization training. Radicular pain demands careful neurological assessment and symptom-modifying strategies. This classification-based approach allows physiotherapists to move away from generic exercise prescriptions and deliver targeted, patient-specific interventions. Clinical guidelines recommend a multimodal approach for musculoskeletal pain. The key question is whether combining manual therapy with exercise provides additional benefits compared to exercise alone. Evidence from high-quality systematic reviews and clinical guidelines demonstrates that combining manual therapy with exercise leads to better outcomes than exercise alone in patients with nonspecific neck pain. Patients receiving combined treatment show greater reductions in pain intensity, improved functional outcomes, and enhanced patient satisfaction. Manual therapy helps restore joint mobility and modulate pain, while exercise improves strength, endurance, and motor control. When these approaches are integrated, they address both the mechanical and functional components of neck pain. This evidence supports the use of multimodal, classification-based treatment rather than relying on a single intervention. A holistic, patient-centered approach is essential in managing carpal tunnel syndrome. Effective care includes patient education, task and ergonomic modifications, splinting, and manual therapy to address neural and soft tissue restrictions. Interventions should be matched to both patient classification and stage of recovery. Acute, subacute, and chronic conditions require different therapeutic strategies to ensure optimal outcomes. AI-driven diagnosis, precise classification, evidence-based intervention, and integrated clinical guidelines form a continuous cycle. This system promotes ongoing improvement in musculoskeletal care and patient outcomes. The future of musculoskeletal care is not just about treating pain more effectively. It is about predicting, preventing, and managing pain through data-driven precision and advanced technology. The concepts discussed in this presentation are supported by peer-reviewed research and clinical guidelines from leading journals in physiotherapy and musculoskeletal rehabilitation.